That was Amir Massenberg reporting from Roanoke. Tonight we are joined by Dr. Emily Bellavance for the interview. She is a breast cancer specialist at the Virginia Surgical Institute. And Emily, thank you so much for joining us.
Thank you for having me.
So who should get screened for breast cancer and at what age? When in the process?
Sure. So an average risk woman should start her annual screening mammogram at age 40. And certainly anybody who is born female should also start their screening at 40. Male breast cancer is extremely rare, but there are some cases where men would get screened for breast cancer, such as if they carried a gene mutation that might put them at high risk, like the BRCA gene that I think most of us are familiar with. And of course, there are a subset of patients who may be at higher risk than the general population, and we may need to start screening earlier or add on additional screening modalities like a breast MRI, or I think you even did a segment earlier this year on the contrast-enhanced mammogram, so we may need to add on those additional screening modalities. And so things we look for: a strong family history of breast cancer. There can be other factors that can increase your risk, like breast density, some of your gynecologic history. So it's best to make sure your primary care is informed of your family history and other parts of your history, so they can figure out if you need additional testing.
Right, and that family history is good to know. But what are some other common signs of breast cancer that people should look out for?
Sure. So ideally, we're going to be picking these cancers up on the screening mammogram before symptoms. But things to look out for certainly are any lump in the breast, or even if there's a new lump under the arm that will warrant some additional workup by your doctor. Occasionally, breast cancer can present as skin changes, like a rash or swelling in the breast. Sometimes it can present as changes in the nipple, like a scaling of the skin on the nipple. And I know that we're often told that pain is not a sign of breast cancer, and that's true, but there are some very rare cases that I've seen where a small tumor might be pushing against a nerve. So don't just brush it off. If it hurts, it must be nothing.
Right,
So,
that is good to know. Always look into it. And what can family members and caregivers do to support someone who gets a breast cancer diagnosis?
Sure. I mean, I think the most important thing to do as a family member for a loved one with this diagnosis is to really take the patient's lead on what they need, because everybody's going to respond to this differently. I think as humans, when we see somebody we love go through something difficult, we're anxious to fix things for them, and we want them to be hopeful and not to worry. And I just think allowing them to have that time to be afraid and let them be upset, and then take their lead about what they need. Some patients might just need somebody to come to an appointment with them. Some patients might need some heavier lifting, like picking up the kids at school, getting some dinners ready, and some patients might just need somebody to talk to.
That's some great advice, because you never know. Everyone is different, and everyone is taking on a different load. I do want to ask you, because there is a new Virginia law going into effect on January 1st, and it regulates what insurance companies can charge in terms of diagnostics. And I want you to describe this better for me, because it was relating to supplemental breast exams. So why is this important?
Right, so this is a huge win for patients, because as mentioned before in the broadcast, some of this additional imaging can cost hundreds and sometimes $1,000.
Wow.
So the additional imaging and tests that we're talking about have to do with helping the radiologist figure out, is this something that needs a biopsy? Is this something that could be a cancer? So that could be something called a diagnostic mammogram or an ultrasound. Or sometimes we need, as I mentioned before, an MRI to further define what's going on in the breast. So I just can't tell you how heartbreaking it is when you have a patient come into your clinic and they have a delay in their diagnosis because the cost was prohibitive to complete the workup.
Right.
And it affects cancer outcomes when you delay treatment, and it's a huge win for Virginia.
That's very good to hear. Well, thank you so much, Dr. Bellavance, for joining us today.
Thank you for having me.
October is Breast Cancer Awareness Month, so it is always good to elevate those voices and make sure everyone is getting their screening done. So
Absolutely.
thank you.